A coping mechanism is a way any individual deals with stresses in their life and a way to basically balance that, emotional imbalance or stress that they have from the situation. So, a lot of us have different ways that we deal with stress at work or family problems or, breaking up with a significant other. And for many people, that way of dealing with that stress is food. A lot of people will turn to a tub of their favorite ice cream or go get a pizza and a beer and watch their favorite movie. So, that is relevant when we talk about bariatric surgery. With bariatric surgery, not only are we causing a stress, which is, undergoing surgery, but afterwards, there are a lot of changes that occur in a person's life afterwards. So, first of all, we're taking away food and the way people normally drink and eat. And with that comes this removal of a lot of people's way of dealing with stress. So it's very important before surgery to figure out a way you're going to deal with stress afterwards, because there are healthy ways of dealing with stress and there are very bad, destructive ways of dealing with stress. For example, if someone has previously had problems with alcohol or drugs or tobacco use, that tends to crop up potentially after surgery because, again, you don't have food to turn to make you feel better. It's actually been studied in particular with the gastric bypass, just because it's been around longer than some of the other surgeries, that people who have had alcohol problems before surgery tend to relapse into those problems afterwards in high percentages. So that's why it's important that even when you're thinking of going into this surgery and as you're going through the process to get the surgery, you want to figure out a way that you're going to deal with stress both now and after surgery, and then implement that. Additionally, you want to figure out how you're going to be eating after surgery and start doing that before surgery, because again, surgery is a stress, and on top of that, you don't want to be trying to figure out your dietary habits and your exercise habits as you're recovering from this surgery. So it's better to plan in advance all these things that you're going to be dealing with. So when it comes to good coping mechanisms, exercise is always a great coping mechanism because it will also help you stay healthy and also help you keep the weight off and get the weight off as you're recovering from surgery. So walking is something anyone can do, and as people lose weight, their ability to exercise more should increase. So a lot of people go to gym classes, and not only are they exercising, but they're basically surrounded by other motivated individuals that'll help them keep going with their goals. When it comes to tobacco, tobacco will increase your risk of almost all complications associated with the surgery. So tobacco in general is very bad and a habit that you really want to be far away from as you undergo bariatric surgery. Additionally, in cases like with the gastric bypass, even years down the line, if you pick up that habit of smoking again, then you can have problems that are specific to that surgery because you can particularly get ulcers in the intestine because of smoking. That's also true of alcohol. Additionally, alcohol is something that people are sensitized to after surgery. People who are once able to drink a lot of alcohol are much less capable of taking their alcohol, essentially. So people who used to drink, hard liquor now get buzzed with just half a beer and that kind of thing. And there's danger to that because if you're seeking that kind of sensation, then that'll make you more prone to alcohol. I'm Dr. Moon. I'm a general and bariatric surgeon with 1C13 Medical.